So thank you for asking me to participate in this panel. A great honor. Maybe we can just go on to, so just to say that I wear two hats, both running as a director of a research institute for aging in Cape Town, and then also being associated with UCT through the Institute of Aging in Africa. If we can go to the next slide. We are conducting through our research institute a number of, prior to the pandemic, we've been conducting a large-scale study where we've done over 2,800 assessments of older persons in a number of communities in Cape Town. One is a rural community about 60 to 70 kilometers from Cape Town. We've done a door-to-door survey on older persons in that community. Then we've been working at 4 primary care clinics using a multi-dimensional assessment instrument to evaluate function and a whole lot of parameters of health and well-being. Unfortunately, we had to come to an end with that at the onset of the COVID pandemic, but we have a plethora of data on the health and well-being of people prior to the onset and very recently, very recent prior to the onset of the pandemic, and hopefully within the next few weeks, as we are able to get back into the community, start doing these surveys again, and will give us an enormous amount of longitudinal data on how COVID would have impacted and on people living in communities. We're part of a we're at the moment part of a multinational study together with colleagues from the UK and Brazil and Mexico, being run through the University of East Anglia, on trying to understand the impact of COVID on care facilities, and just this morning, possibly that was what caused all my technical problems with my computer, was that I was on another Teams meeting to start looking at seroprevalence of COVID-19 antibodies in care facilities. Most of the work that we've been doing at this point, and if we can go to the next slide, has been around advocacy. And so got a number of publications together with colleagues from around the world. In the BMJ, we've had 2 publications looking at COVID-19 in low and middle income countries, and then looking at how the WHO needed to prioritize the need of older persons, recognizing the fact that it was older persons who bore the brunt of the illness from COVID. Also looking at some sort of data that's in South Africa, and the lack of data and how it's impacting on us trying to develop decent responses to COVID-19 in care facilities, and then with colleagues from Canada and Europe and Singapore as well, on just once again doing some preliminary analysis on why and how COVID impacted so badly on nursing homes. So those are some of the publications we've had out in the last few months. If you can just move to the next slide. Also from our research institute, we've been quite actively involved with the WHO and sitting on 2 advisory groups of the WHO, as well as working with the WHO to develop the infection prevention control guidance for long-term care facilities, and then also the other guidance that came out from the WHO on preventing and managing COVID-19 across long-term care services. That's the longitudinal services that are provided across the continuum of care for older persons. If we can go to the next slide. Then we've been quite actively involved in, we had some minor contract research with looking at NCDs to advise various national departments of health, locally and globally, on the management of NCDs post-COVID. We've developed guidelines working together with a couple of other organisations on how administering pension payments could be more effective in the context of COVID-19, that older persons weren't able to go out into their communities and collect their pensions. And then just looking at, from our own institute, just putting together all the guidances from around the world and looking at what best care practices are available and putting that out for long-term care facilities, because there's been quite a dearth of information that's not been available from many authorities that should have gone out to facilities, particularly in South Africa, where most care facilities fall under the ambit of the Department of Social Development, and there's been a relative lack of information going out to them. And then we've also been involved in trying to assist the Western Cape Department of Health on developing an action plan for older adults. So we've had a lot of activity from our research institute in terms of COVID, and we're uniquely placed because of our work at a primary care level in older persons, and there's not very much happening in South Africa at a primary care level on research into older persons. So if we can go on to the next slide. So some just very quickly to jump to what lessons can be learned, and I think if we can quickly go, where do I think the future of our research lies? And if we can go to the next slide, please, Denzel. Okay, so I think really one of the things that is really important, and unfortunately I haven't heard any of the previous speakers because of the technical problems of getting onto the system. I think that we really need to hear the voice of the person. I think we often forget to listen to the voice of the older people. They've been very, very significantly impacted by COVID. I think areas we need to understand is what have been their feelings and their fears and expectations. Lockdown has been foisted upon them. They've been denied access to their families, access to social activities outside, and I'm talking about particularly people living in care facilities. People who may be at a relatively, they are at the late part of their lives and may have a relatively short life, and they do have relatively short life expectancies, and they've been under lockdown. And we've taken the approach of safety first, and let's lock down a facility. Let's make sure that we keep people alive. But if we're keeping people alive for 9 months, 10 months, 12 months in a facility where they are locked down and are unable to have contact with the outside world, what does the world look like for them? And what is that the life that they choose to lead? So I think we really need to focus on the voice of the person and look at what does implementing advanced directives mean? What does a life look like when you are under lockdown? I think we really need to understand the environment where we're living, and how, in particular, in care facilities in low and middle income countries, with the lack of access to PPE, legislative policies that have not really taken into account older persons. Most low and middle income countries focus on other aspects of health and well-being other than older persons along the continuum of along the life course. So I think we need to bring older persons much more into the spotlight in terms of how does legislation impact upon them, and that they do need to be at the forefront of new healthcare policies. And we need to understand the relevance of older persons in society. So if we can go to the last slide. I think we need to understand why did some systems cope better. And I do believe that we need to aim to improve, sorry about that spelling error, aim to improve the quality of care that we render. And to do all of this, we need to be data driven. There's a dearth of data in this whole sector. In many of the OECD countries, there's a wealth of data, but certainly in low and middle income countries, there's a complete lack of data, lack of regulation of the services that are available, or lack of regulation of services that are provided. There's a lack of regulation of the quality of and skills that need to be provided. There's a lack of knowledge about and data about how many people live in facilities, what's the age, what's the length of time that they spend in facilities, what are their health needs, what are their care needs. And I think we need to work towards a much more data-rich society, that we can build on better information systems and forward our knowledge so that we can implement effective change. So thank you very much. That's my very brief presentation, and I apologize if I am running over time.
Thank you very much, Prof. Geffen. So we have plenty of questions on the live Q&A from the audience, but due to the lack of time, I would want the panel to summarize your observation, like what is your key observation on the impact of COVID on aging, and what is the future lies for aging population post-COVID in about 30 seconds. So in 30 seconds, please respond. What is the key impact and what is the key changes, or what we should strategize to make sure that aging population is taken care of well, starting with Nick.
Thank you very much, Swadesh. So in 30 seconds, I think we need to recognize that we haven't really considered all the individuals in this pandemic at the start, and we have to, what needs to change is really put them at the front of the planning and ask them what they want, what are their priorities, what are their needs, and as in, and I think I've forgotten the second question now, but we should prioritize investment in aged care and better care with appropriate resources and staffing.
Thank you very much, Nick. Lenny?
Yeah, I think it's striking to realize how important social interaction or isolation and loneliness is, especially among the elderly generation, but also among the youngs, and how that can affect health, biological health, actually. So I think that is extremely interesting to look more into that in the future. And I also think it's interesting that we very quickly have developed new ways of working, education, interaction, and we're doing it now online. So yeah, that's a few points for me.
Thank you very much, Lenny. Angelique? Yes?
Okay, in 30 seconds, I think the systems modeling is important. We need to be better prepared when this happens again, particularly in terms if it's a disease that has a higher mortality rate among older people. Our hospitals pulled up very quickly. We converted an entire expo. We converted car parks into isolation wards, but that's not enough. So we need to do more thinking in terms of the system. Thank you.
Thank you very much, Louis?
Yes, well, I think the pandemic is really putting in sharp focus, not just the scale, but also the scope of inequalities in the ability of older adults and the whole community, for that matter, to really benefit from health and social care and the power of communities. At the same time, I think it has shown that communities can come together, not just the communities where people live, but communities of researchers in an amazing way, with an amazing effort have been put towards finding solutions. And there's an opportunity to capitalize on that momentum, to rethink how we work together to address the core challenges that we've been working with for many years, but all in silos.
Thank you very much. Yeah, I concur with everything that everyone else has said. I do think that we need to hear the voice of the person. I also think we need to look at a much broader issue around policy, legislation, advocacy for care of older persons. And we need to, I think we need to build up a much better data set of what the needs are of older persons. So I think this is we've got incredibly low hanging fruit for, I'm not sure who the audience is out there, but if you are young researchers, I think this is the most exciting field, I think, over the next 10 to 15 years to go into, because I think it's completely under-researched, and there's a plethora of need, and I think we can make a significant impact.
That's fantastic, Leon. I think you kind of summarized what we were wanting to get out of this panel discussion, to emphasize more on research around aging and health. So with that, I would want to thank all the panelists who took the time to present their key observations. Prof. Nick Cherubim from Australian National University, Prof. Lenny Joel Remison from University of Copenhagen, Denmark, Prof. Angelique Chan from National University of Singapore, Prof. Leon Neville Geffen from University of Cape Town, South Africa, Prof. Lois LaFortune from University of Cambridge, UK, and Professor Sarah Happer from University of Oxford. Thank you very much for all your contributions, and I'm sure the audience will get back to you if there is any questions from their side. With that, we conclude the panel discussion, and I hand over to the chair of the conference, Professor Thomas.